So there's a lot of things that a lot of people like misunderstand about IOP. I think the biggest one is that when you need IOP, you failed regular therapy, so like outpatient therapy. And the reality of that is that IOP can be seen as relapse prevention. It also could be like a form of step down for like a higher level of care for like residential or inpatient. And it just provides a little bit more support than what outpatient can provide. And sometimes clients need that additional support, and that's okay. So it's not, or it shouldn't be looked at as like a failed regular therapy, but more so just being like proactive in early intervention. IOP is most effective as a standalone level of care when the symptoms are typically moderate and stable, when we have a lot of motivation and commitment to do the therapy, when a support system can be built, and again, when we need to do crisis prevention or like early intervention, and typically when they can function outside of programming hours. So like they're able to be stable, can manage their meds correctly, and not needing like 24-hour support. Typically with PHP, there's a lot of ongoing and around the clock care. We often recommend IOP after PHP because it prevents that care cliff, right? So you're going from a structured, organized level of care with a lot of support to minimum support. And so being able to keep or then go into IOP will help keep the stable structure. PHP is more so we learn these skills versus IOP is like now we're implementing these skills, and so it allows exposure to like some of the things that maybe PHP blocked. So originally there was one IOP track which was just for PHP step downs as well as the community kids, and we started to see that a lot of our PHP step down kids were not as engaged because this was like repeated material and content, and so we were losing their attention during group, and we just wanted to try and figure out how can we make IOP for these step down kids more productive and effective at the end of their 7 weeks. And so what we did was we created like a whole nother curriculum for PHP step down kids, which still included some of those foundational skills that they learned in PHP, but it was more so about building onto those skills while also adding in like a lot of attachment things, because we know like in the mental health field, especially with teenagers, there are a lot of attachment things, whether it's with family, friends, and so like just helping add another component to that curriculum that was more relatable to the teenagers was super helpful. Just trying to tailor it to each of those, the different groups' needs. So Horizon, again, that's the PHP step down, and this is more so of, we have the DBT skills like emotion regulation, distress tolerance, and mindfulness, but also building on like executive functioning skills, attachment, like where our attachments stem from, and also because a lot of our kids do struggle with that executive functioning piece, trying to figure out how can we better support them, not only like in the home environment, but in the school environment, and then helping them increase their ability to utilize the DBT skills that they've already learned in PHP. While the River track, which is the community kids, is majority distress tolerance skills, emotion regulation skills, mindfulness skills, a lot of being able to process their experiences with their peers, and a lot of intentional skill use. And then our virtual IOP program, their curriculum mimics the River curriculum. IOP provides structure, support, and treatment, and I think that the results depend on, one, your engagement in treatment, your aftercare, having like outpatient support set up, and so all of those will determine like the results. IOP involves the group therapy component as well as the individual therapy component. A lot of our kids do love individual therapy, which is fair because like you get to process some things that you typically wouldn't share with other people. I really love the group therapy because it gives them that real life exposure to things that they are going to see like once they discharge from IOP. The work is relational and it's a lot of exposure, and so just being able to see them gain that confidence from admission day to discharge day is fulfilling and rewarding. And so yeah, IOPs is a game changer.